honor of Breast Cancer Awareness Month, our reporter Karina Gary spoke with an expert from MVHS about warning signs and what you should look out for.
Breast cancer kills more women in the U.S. than any other cancers besides lung cancer, and 1 in 8 women will develop invasive breast cancer in her lifetime. In honor of Breast Cancer Awareness Month, I spoke with an expert from MVHS about warning signs and what you should look out for.
My recommendation to anyone I meet is always to just kind of get a general self-awareness of what's normal for them.
She recommends waiting 7 to 10 days after your period to examine yourself. That is when your breast tissue will feel the least lumpy. It's best you get an idea of what's normal versus abnormal for you through routine self-examinations. But what is considered abnormal?
Things that are abnormal tend to be painless. Not always, but they tend to be. And they also tend to be things that they don't move necessarily. They're kind of more fixed in one spot.
She uses the example of a frozen pebble because it's usually pretty firm. If you feel something or believe something doesn't feel right, it's important that you say something right away. There are a few things we know that can possibly help control your risk factor. One is the age at which you have your first child. Having a child younger is good. Breastfeeding is also statistically proven to lessen your chances of having breast cancer. But the most important is diet and exercise.
Leafy green vegetables, whole grains, minimal meat, and specifically minimal red meat for women, and then minimal alcohol consumption as well.
There is still so much unknown surrounding what causes breast cancer, and receiving that diagnosis can be terrifying. Just this last month, MVHS has launched a brand new program called the Multidisciplinary Breast Cancer Clinic. The clinic is for newly diagnosed women. They can come in and sit down and meet with all of the doctors that will be responsible for their care in one setting and on one day. Reporting in Utica, I'm Karina Gary, Eyewitness News.